Letters is really cool. So letters works through templates to generate letters for a patient. So let's say I want to generate a letter. Let's pull up a different patient. Let's say I want to generate a letter to a person's primary care doctor at their initial visit. So I went ahead and made a letter template, and I can pull that letter template, and let's say I just say EL new patient letter. Oh, this patient doesn't have a lot of stuff. Let's pick a different patient, sorry. I'll pick me as a sample patient because my chart's populated. So it's sample patient Ethan Lazarus. And I can say letters, generate letter, EL, new patient. That's just one of my letter templates. And you'll see what it does is it goes ahead and it writes the address block, and these all are being populated from the template, so you can tell it which fields you want. So it put my primary care doctor. That was indicated in the patient history. Dear first name of primary care doctor, had the mutual pleasure seeing our mutual patient, blah, blah, blah. It says which meal plan they were started on, which medication, starting weight, goal weights that were calculated. And so it generated this whole letter for me. And when I add the letter, it takes all the different letter pieces and actually makes a note for the patient. So if I go back into communications, now I have letters, and I can actually look at the letter that I just wrote. And the letter is here, and it takes my header, puts a date, the doctor's name, all that information, and then it attached chart notes. You can attach anything you want. So it attached my medical history, my diagnoses, medication list, and then it made a mailing label. So to print this, I would just click in the box and hit the printer icon, and it'll let me print. And then if you have a labeler and you want to make a mailing label, you can just print here and print this to your labeler. And that's it. You've just generated a letter to the primary care doctor that's become a part of the patient's chart. You can use the letter writer for so many other things, like return patient forms. Patient hasn't been in a year. You can make a return patient form that's pre-populated and just ask the patient if there's any changes. So letters is really cool. Chart export is for exporting your chart to another care provider. So chart export, you just go through and export chart notes, a lot like what I just showed you, and it ends up just generating an export that's real pretty that has all of their visits and anything you ask it to include. So, and it does it in a pretty efficient way where you're not going to go through 200 sheets of paper. So that's a summary of all the doctor visits in a table. It's pretty slick. You can have it export the EKGs, the labs, or whatever the patient asked for in the event of a compliant chart release. Informed consent documents I showed you in the patient portal. So you can scan signed consent forms, or you can get signatures on consent forms, and you can control what consent forms exist for your patients. So let's say I want this patient to sign a QSIMIA informed consent. I'm going over QSIMIA. I just pull up their informed consent form, I hand them a pen, ask them to sign their name, and ask them to sign it, and I just capture their signature. Interestingly, they can access those consent documents from home if they want to read over it more carefully, or you can print a copy for them. And then the patient food journal you already saw. Scans and pictures is where you can capture anything from outside, any type of outside document. So that's where this picture came from. And so you can attach any type of document, picture, outside charts, old chart, paper chart, whatever you want, would all go into scanned documents. And then you can view the document just by clicking the link. Dispensing is very, very powerful, and if your office does dispensing, this is great. And so in the dispensing table, this gets populated when you write your doctor note, or you can add medications directly to it. So let's say you're going to add a medication, you have a patient on phentermine, 28 pills, 1 a day, dispensed in the office. Our office has an order for an extra number 7 on every prescription. We call that extra week. And it has to be a signed order. So I just wrote this patient for 3 refills on phentermine. You can see it pops up in the header that they have 3 refills left on phentermine, and that expires in 6 months. And then the front can dispense it. Our office, the front office, can dispense based on these orders, so they can click dispense. They can add. They can say, okay, so we dispensed it or we called it into the pharmacy. I don't know anybody else's password, so I'll use myself as the dispenser. So suppose I filled this and handed it to the patient. I can go ahead and keep track of your batch, whatever it is, and then it generates a label too. So it generated this label. So if you have a label printer on your dispensing station, you can just click the print button and you'll make a label. And now I added the dispensing, and if we return to the dispensing orders table, look, now we only have 2 refills left. And you can see that 3 refills were ordered and 1 refill was dispensed, so there's 2 remaining. Green means it was good. Red is anything that's standing out. -1 means they don't have any refills left, or it's red if it expired. So really a full-featured dispensing module that you could use to dispense in the office, or you could use to track drugs like Qsimia, where you might want them to show up in this section. And then graphs are very similar to the graphing section that I showed you in the patient portal. So you can graph just about anything. You can graph their cholesterol. Maybe we just want to graph their cholesterol and their LDL and what happened to it with the weight loss program. So that we don't make this video too long, I'm going to jump to practice management. This is where a ton of the features are that you'll use. This has a staff messaging system, so I could say create message to staff, and I can add a message, and I designate which staff. If I click them all, they all get it. So if I want to do a message to my whole staff, I can just click everybody. But let's say I just want to send it to me. You can attach a file if you have an article you want your staff to read, or your dietitians to read, or your PAs to read, or your other doctors to look at. So I send it to myself, and look, in my bin, my menu bar updated and says I have a message from Ethan Lazarus. So I can click that, and it'll take me straight to that message, and then as soon as I've read the message, it'll clear it from my bin. So now my bin just got cleared, no more message there. Integration is integration that we've used for appointment reminders or super bill summaries. Dispensing is where we're going to generate monthly or daily logs. So we could look at a monthly dispensing report, and it shows me for January of 2013 how many of each medication we did. And going back, you can track all your dispensing for each medication. It'll also make a dispensing log showing exactly whom you dispensed to and what you dispensed for your archiving purposes. You can do a dispensing log. And so here we have the dispensing log. We'll do this daily, and today the only entry in the dispensing log is the one that you just saw me do. These are the letter writer templates and the informed consent documents. That's where you can create those. Lots of stuff in other, like which foods do you have in the food database, exercises in the exercise database, billing codes. So you can get into all of these without being a coder and really customize everything to your practice. Let's see, views are really cool. So you can go into, let's say for example, all MD visits. And I want to look at all the MD visits between 2 dates. So let's say I was out of town last week, and I want to look at everything from last week till today. I can search by that criterion, and it'll show me there was just this one note, the one that I just wrote, that was written, and I can link straight to that chart. So these views are very powerful. Or let's say you want to look at a view of all of the EKGs that were done in your practice. Now let's say you're wanting to do some research. So let's say you want to see all the EKGs in your practice that had a QTC above 440. You can see how many times that actually happened and which patients that happened in. Or you could do a view of all vital signs. So let's say you said the date. Let's say we had the total weight loss is greater than 50 pounds. So this will tell me all the weigh-ins that have more than a 50-pound weight loss. So pretty powerful. Those are called views. And graphs, these are practice-wide graphs. So let's say you want to do a weight loss by meal plan. I can look at my let's see, that's not the graph I wanted. Oh yeah, you can do it by meal plan. So this is all of my programs where we could search for just our OptiFast patients. And so that's one graph that you could generate, and you could see how your different meal plans compare to each other. Lots of other graphs you can do. You can do gender distribution. Are you seeing men or women if you're curious? So it generates that for you. Weight loss by medication, if you want to see how your different drugs are performing. It'll query the database, and you could turn on or off whichever medications you want to see. So you could just look at a weight loss graph for people on metformin, 50% weight loss. Marketing graph, this shows your referral source. So you could see that most people are coming from friend or family, and who the referrer was. So some pretty cool graphs that you can get. The system has a comprehensive, let's see, it has a comprehensive help system, resources, so we've loaded up with the PIs for the medication we use, information on our clinic that we can get right to. Your bin, that's your test, your to-do bin, and so on and so forth. So that is a really brief overview of what the CNC Patient Chart does. I hope that helps understand the depth of the features and what it can and what it can't do. Again, this is Dr. Ethan Lazarus. You've been looking at the Clinical Nutrition Center Patient Chart. Thanks for your time and have a great day.